As Maryland continues to see its COVID-19 positivity rate drop, we are now learning more about where and how some people have contracted the disease, all in hopes of preventing the spread.
Knowing where outbreaks start and originate and how they might be spreading is really important.
Dr. Jonathan Thierman, Chief Medical Information Officer with LifeBridge Health, had a look at the numbers with 11 News.
If it's MD COVID, answer the call.
Through the state's contact tracing initiative, COVID Link, those who test positive answer questions about where they were before they contracted COVID-19. So far, we know the following. Since June 15th, more than 53,000 people have been entered into COVID Link. Of those, almost 39,000 have completed their interviews. A further breakdown shows when it comes to social gatherings of 10 people or more, 13% did attend such an event, 57% did not. Another area considered was high-risk locations such as restaurants, stores, parties, or religious gatherings. 41% said that they went to one, 30% did not. And then there's going back to work. 26% said that they did go back. 49% said that they did not.
As aggregate data, it kind of gives us some general understanding of where people are more at risk and less at risk, whether it's eating inside in a restaurant or other things that are higher up on those risk categories, going to work in a work environment versus working at home.
Dr. Thierman says the data is invaluable when coupled with actual physical precautions such as wearing masks and social distancing. It should help to continue flattening the curve.
Simply one of the key elements that will help us open schools, open businesses. I think that that's a very proactive thing that will help us kind of advance and get back to something like normal.
And for a closer look at the data provided by the state, we have some links on our website, WBALTV.com, and on our mobile app. In Northwest Baltimore, I'm Lowell Melser, WBAL TV 11 News.